Hi, I'm Dr. Rena Azar, and I'm here with Chelsea from Medtronics, she's my helper from Medtronics that comes over and helps me to do trials when we are going to test and see if the Interstim pacemaker device is going to be a good thing for you. As we discussed in the office, the Interstim pacemaker device is a device that helps to treat people that we suspect have neurologic damage, and neurologic damage shows up in many different ways. People who have got neurologically compromised bladders will have urgency, frequency, and retention. Retention has a lot of different ways that it manifests itself. For example, retention can be hesitancy, retention can be slow stream, retention can be secondary emptying, which means you urinate and then you have to sit still for a little bit and then you urinate again. Urinary intermittent stream can be another way that we see urinary retention. In addition, the device is also indicated for fecal incontinence. Incontinence from the rectum can show up as incontinence, which is urge-related, meaning you're trying to get to the toilet and you can't get there in time. Or it can be just actual leakage of stool and you're not even aware of that. That's called insensible fecal incontinence. At any rate, we're here today to go over what to expect on the day that you come for your Interstim trial. So the day that you'll come here, I will be here and we'll have a couple assistants, and you'll lay on the table as I described to you already. You'll lay on the table on your tummy. We'll position you in a certain way, and then we will prep and drape you, which simply means we wash things off to make it very clean. This is a sterile procedure. And then Chelsea will come in. She's going to get a baseline from you. So we'll send you with a questionnaire home the day that we talk about Interstim, and that questionnaire is going to go over the following questions. And what is important for us to know is, how do you answer these questions before the trial? And how do you answer these questions during the trial? When the wires are in place, how is your bladder behaving? Those questions will go over some of the questions I've already asked you, which are, how long can you hold your urine? How many times do you get up at night to urinate? And what percentage of the time are you rushing to the toilet? In addition to this, we'll ask you how often you're noticing that you leak stool, either urgently or insensibly, either on the way to the toilet or you just happen to notice it in your pants. These are the questions that we'll ask before and the questions we'll ask after the wires are placed to see if this device is working for you. When you come into the office, you'll have these wires placed, and you're going to actually see a brief video after this where I talk with a patient who just had the wires placed, and she survived it, and she's doing well, and you can see what it looks like. And after she sits up, what will happen is, actually, before she sits up, Chelsea will put a bandage over those wires, and then she'll sit you up, and she's going to go over a few things with patients before they go home. So I'm going to let her go over that with you.
Yeah, so you'll be all taped up, and you'll also have a little belt on that you can wear under your clothes. And so you just have to be careful to limit your restrictions: bending, lifting, and twisting. So no excessive bending and no excessive twisting. You can do everyday normal things. Just anything excessive, we ask that you just limit that for the trial. You'll also go home with a little programmer, and after the wires are placed, I will sit you down and show you exactly how to use the programmer and what it's used for and what you'll do with it throughout the trial. Another thing I'll talk to you about is Medtronic will call you after the trial because they want to know the answers to your questions on the questionnaire to see if you're getting some improvement or not.
So an important thing to mention, as Chelsea has referred to, you have these little wires sticking out of your bag. These wires don't have any significant anchoring, so they're kind of relying on a little friction to keep them in place. And that's why we don't want you doing stretching, bending. We don't want them to get infected. That's why we ask you, or pulled out during a washing process. So it's just better to not shower or bathe. You can wash your hair in the sink. For all of us women that can't stand to not have our hair washed, and you can take a little sponge bath. I also like to remind people that you're going to come in. We'll usually schedule you for a day to come in and have those wires removed. It's not painful. We just put a little gentle pressure around the site, and we gently pull the wire out from underneath the skin. And I remind people that this device can be worn up for 2 weeks at a time. So the nice thing about that is if your symptoms are equivocally responding, in other words, you've had it in maybe 2 or 3 days and you're like, I think it's working, but you'd like a little bit more time, you can just call and say, hey, I need to try this out a few more days or another week, and that will let us reschedule you, and you get a little bit more time to test drive this device. I also want to emphasize something really important about this device. This device works pretty quickly for urinary urgency and urinary frequency, because that's a matter of communication about volume and brain exerting its control over the bladder's functioning. However, the symptoms of urinary retention are going to take a little longer to respond. So usually people will notice that there is some immediate effect on improving your ability to empty your bladder. However, it is important to know that urinary emptying is going to be dependent not only on the coordination of the muscle fibers, as we discussed, but also, really importantly, there's a lack of strength of those muscle fibers. They're less strong because they haven't been being used properly. They're less strong because the tone that is given to that muscle because of the nerve stimulation has been less or absent for a long time. And so once we put that stimulator in and you have the stimulation of the electrical current going on, over time the muscles will be not only coordinated, but they'll actually be stronger. And so the benefit of the strength in emptying the bladder comes over time. So I do remind people that although frequency and urgency will generally respond quickly, retention is a little slower to be responding. Do not get frustrated with that. And then finally, fecal incontinence. Usually we'll see a pretty immediate response with fecal incontinence as well. So that's an overview of what to expect on the day that you come in for your PNE or Interstim trial, and you get the little wires placed under your skin, kind of in the back region. Hopefully that's helpful for you.